Hello, everyone. I'm Jocelyn Chisholmer, Director of Governance Policy and Performance Measurement at CADIF. Welcome to the latest talk in the CADIF Lecture Series, which we launched 7 years ago to give people from across Canada and beyond the opportunity to hear directly from prominent scholars and opinion leaders about pressing issues facing health technology assessment and healthcare today. I'm hosting the session today from Ottawa, Ontario, Canada, which is in the traditional unceded territory of the Algonquin Anishinaabe people. Since time immemorial, the Algonquins have been the keepers and defenders of this land. Part of the value of a territorial acknowledgement is incorporating some personal reflection. So I'd like to take a minute to speak about recent reflection I was having. The Globe and Mail on the weekend published a few pieces on ravines in the city of Toronto. And I've been spending more time in nature recently, trying to get some exercise and fresh air. And I was just reflecting on those ravines, those urban pieces of nature, and the wetlands and the forests that actually no longer exist in our cities, and thinking about the geography of the place where I live and what it once might have looked like, and the importance of protecting what we have today. So I'll encourage everyone joining the webinar today to think about where you are, the land you're on, and to give thanks to the people who came before you and cared for and sustained that land and are continuing to advocate for those values today. The title of today's lecture is How to Advance Gender Equity. It builds on a talk that CADIF hosted on International Women's Day back on March 8th that explored how COVID-19 has exacerbated gender inequities for women in Canada and around the world. This topic is too important to limit to a single day of the year, of course, because the evidence shows that greater gender equity is better for health policy making and better for patient care. So today's talk will look specifically at the occurrence and consequences of gender inequity in medicine and academia. Our two speakers will discuss why gender equity is important and provide a range of strategies to promote gender equity. So let me introduce them. Dr. Larissa Shamseer is a postdoctoral research fellow with the Knowledge Translation Program of the Li Ka-shing Knowledge Institute at Unity Health Toronto, where she is examining equity in academic reward and publishing. She completed her PhD in epidemiology with the School of Epidemiology and Public Health at the University of Ottawa. She's the lead author on a recent brief report in the Journal of Clinical Epidemiology that discussed strategies academic institutions, funders, journals, and men in academic science can adopt to address gender inequities. Presenting with Dr. Shamseer today is Dr. Andrea Tricco, scientist and the director of the knowledge synthesis team in the knowledge translation program of the Li Ka-shing Knowledge Institute with Unity Health Toronto. She's an associate professor at the University of Toronto in the Dalai Lama School of Public Health and Institute of Health Policy Management and Evaluation. She's also co-director and adjunct associate professor for the Queen's Collaboration for Healthcare Quality, Joanna Briggs Institute Center of Excellence at Queen's University. So let's begin. I will turn things over to Dr. Shamseer and Dr. Tricco to get things started.
Great. Thank you so much, Jocelyn, for that great introduction. I am now going to share my screen and hope that this will work. Let me know. You just see my slides, Jocelyn? Yeah? Okay.
Looks
Excellent.
great.
Awesome. Thank you so much. So it's an absolute pleasure to be here today speaking with a close colleague and friend, Larissa, on a topic that you will see we're incredibly passionate about, advancing gender equity within medicine and academia. And although our title does focus on medicine and academia, many of the things that we're talking about today can actually be applied broadly. So it could be applied to different disciplines above and beyond medicine and academia. So I would like to as well acknowledge the traditional land on which my research team operates on in Toronto, Ontario, Canada. And for thousands of years, this land has been the traditional territory of many different nations, such as the Anishinaabe, the Chippewa, the Haudenosaunee, the Wendat, and the Mississaugas of the Credit Peoples. I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. This land is home to many diverse First Nations, Inuit, and Métis peoples, and I personally am incredibly grateful and also humbled to have the opportunity to work on this land. So Larissa and I would like to acknowledge a couple of competing interests. So when it comes to financial competing interests, I have nothing to declare, or I declare no financial competing interests, and Larissa declares that her spouse receives income from a scholarly peer review management company which he owns. A contextual competing interest is that we are both women, and we're talking about gender inequities today. And then in terms of academic competing interests, as I said at the beginning, we're incredibly passionate about this topic. We have an academic interest in this area, and we also both hold grants in this area. And we are also unpaid associate editors for the Journal of Clinical Epidemiology, as well as for systematic reviews. So today we're going to be talking about the scale of gender inequity and what may contribute to it, as well as why is it important, and then offer some potential solutions. I'm then going to turn it over to Larissa, who's going to focus on the impact of COVID on women in academic science, and in particular focusing on early career women, looking at how do we measure productivity and what are some solutions as well. So we really want this to have a solutions lens on it and to provide some recommendations on how we can move things forward. And I'd like to note that our talks are based on a couple papers that we've recently published, and the citations are there for you. So when we talk about gender, I want to note that it's a multi-dimensional concept. It is not binary. However, the research is set up that way, and often traditionally the way we've thought about gender is men and women. We're going to be talking a lot about men and women, but we want to know upfront, gender is not binary. We're just talking about it in this way just for convenience sake, and because we are highlighting research in this area, and the research is set up that way. We also want to note that our social identities are compounded by systems of privilege, power, and oppression, and this leads to inequities and discrimination. So when we're thinking about gender and when we're thinking about inequities, we also have to think about social identities above and beyond gender. And when we're thinking about gender, we need to consider this regarding our societal roles, our norms, and our relations. And I will be getting into this in a few slides. So again, the focus of my talk is going to be on a paper that we recently published in the CMAJ. So I wanted to talk a little bit about medical leadership. So we know that women have outnumbered men in Canadian medical schools for 25 years now. However, when we think about it, the further you go up within an organization, the less and less we're seeing women in these high level positions. So we see that they're less likely to reach higher ranks. So if we think about the Canadian Medical Association, only 8 of the previous 152 presidents were women. If we also think about becoming a dean, so within the Department of Medicine in our Canadian universities, it took 170 years for the first woman to become dean, and we've had only 8 since then. So we're seeing a real gap when it comes to leadership within medicine. And when we think about some very prestigious medical opportunities, such as being on a guideline panel, being a senior author, and then also thinking about reference letters. In general, female clinicians are underrepresented on guideline panels. They are less likely to be the senior author, and they're less likely to obtain supportive reference letters. They're also less likely to be addressed by their professional titles. So this is all based on research, and you'll see I have some references here on my slides and also at the end if you wanted to dig deeper into this. Research into the pay gap has shown that this can be very wide, so it can range from 30 to 40%. So that's also concerning. And when you think about considering multiple social identities, so when you look at gender plus race and ethnicity, this gap is actually much, much wider. So again, when we're thinking about gender, we have to think about multiple dimensions, and we have to come from it with a multi-pronged approach as well. So why does gender inequity exist? So a lot of reasons that you may hear is that, well, it's a pipeline issue, right? So there's just not enough women who are, around to be leaders. Well, we've seen that's not the case. Women have outnumbered men when it comes to doing the education. So it's not a pipeline issue. It's actually not an aspirational issue. So again, when they've done interviews and surveys, women have just as much hopes and dreams as men when it comes to career. So it's not that women don't want to do these positions. It has nothing to do with it. It actually has to do with how we were raised and how society teaches us how we're meant to be, right? So if we think about our gender roles, so think about all the unpaid time that women traditionally take care of our homes and take care of maintaining the home and maintaining the caregiver role within the household, right? So they've actually quantified that women clinicians spend 100.2 minutes more per day on household activities when they compare this to men. Okay, and actually during COVID, this number has gone up substantially, right? So Larissa is going to talk a little bit about the impact of COVID, but this would be a real thing here with our kids being at home, right? Women are spending actually even more time on the household and caregiving right now. And it's not only with their children, it's also with their older parents or older family members. As an example, that usually is a woman role. And this is, again, the way we were taught in society, okay? There's also gender norms. So women receive less supportive letters of reference, and they also have less leadership opportunities. So we have been taught that the characteristics of a leader are those attributes that those characteristics that we attribute to a man. So we have been taught that, being assertive and, presenting in a certain way is more of a man type of characteristics than women. So then when we're writing the letters of support or letters of reference for women, we use usually words that are more kind of like the grunt work, so very hardworking and very dedicated, whereas versus men, we would say things like, oh, brilliant, trailblazer, and these kinds of terminology. Again, this has all been highly studied. And so this may lead to less leadership opportunities. When we think of who's going to lead this organization, we may automatically think of a man because it's just the way we've been taught with society, right? It actually starts very young in childhood with even think about the fairy tales and all the things that we learn in those stories that we read as children. And then also gender relations. So an example would be that women on average experience more bullying and harassment in the workplace compared to men. So this has an impact as well. So what I'm trying to get at with this is that it's not a simple issue, it's actually a societal issue. How do we change the way we operate in society is not something that we can easily tackle, even though there are some solutions that we can incorporate and do today. But just to say that this is a very complex issue and that we are not trying to blame anyone here. We're not trying to blame men. We love men, we want to work with men, and we need our men as our allies. It's just to say that it's actually a societal problem and we're all to blame because we're all part of the society. So why is it important? And Jocelyn gave a really nice few notes on this in the introduction. So at the end of the day, it's an issue of justice and rights. So if you want to have an opportunity to be a leader and you're a woman, you're a man, you're any other type of gender, you should be provided that opportunity. So how can we help get these people ready for those leadership positions and provide them with those opportunities? There is some evidence suggesting that women actually provide better quality of evidence-based care. So we've seen lower rates of mortality, hospital readmissions, and emergency department visits as example. On average, women spend more time with patients. They use a more patient-centered approach. And when they have looked at boards that have included women as members, there has actually been less corruption on those boards. And there's some evidence that there is more thoughtful decision-making when women are included. So there is great value in trying to achieve equity when it comes to gender. So I'm going to switch gears a little bit and talk about some solutions. Again, you know, we really want the focus of the talk to be on what can we do now, and not lamenting on the issue. I think, you know, we can all agree that that we've come a long way in some cases, and that we still have a long way to go. So what are some things that we could do right now? So this again is based on the paper that we published in CMAJ. And what I want to note is that this was a commentary, okay? So we didn't assess the quality of the interventions, and also want to note that many of these solutions or interventions that I'm talking about, there is very little evidence out there on them. So this would actually be a call to everyone here, if you're interested, to try to conduct more research in this area. So again, we see our Canadian Institutes of Health Research making this a priority, and Larissa will be talking about that in her presentation as well. So it is important for all of us to come together and do more work in this important area. Okay, so what could we do? So one thing would be actually communicating statistics that have gender and multidimensional social identities reported, right? It's very hard to find this information. We just don't record it, right? So starting to record those statistics and then also communicating them, right? Because if we don't see the numbers, many people in science were numbers people, right? So we want to see the data, we want to see the numbers. If we don't see the numbers, we don't think there's a problem. It's kind of out of mind. So number one, we need to see the numbers, okay? We need annual reporting. So the reporting, we can't just rely on data from 5 years ago, 10 years ago. We need this annually at least. And we want to look at also the impact of any gender equity efforts that we've made or that we've been working on. And again, this needs to be publicly available. We want to see hopefully some progress over time. Okay, so then the other thing that we want to talk about is actually a career flexibility. So when we're thinking about our careers, you know, we want to think about how can we meet both our career and our life goals, right? Because if we're happy in our personal lives, we're going to be happy in our careers, right? And so we have to think that our personal life and our careers are linked. So working to come up with customized plans so that we're able to reach those goals. Also an interesting idea that was proposed in the literature is a time banking system. So let's say, for example, you know that you are going to have to go on parental leave, or you know that you're going to have to, you know, assume more of a caregiving role for your elderly parents or family members, then maybe you can bank some hours now so that when those caregiver responsibilities increase, you can use some of that time that you banked in lieu, right? So it's really about offering flexibility. Okay, thinking about non-gendered parental leave schemes. So this is very common in Scandinavian countries. And if you look at those countries, the gender gap is actually not as large as in North America. So this would be encouraging any gender, if you want to take a parental leave, take a parental leave. Excuse me. So making sure that we have those schemes in place. Another example is shortened work days, right? So a more intensive work day, but it's shorter, right? So allow you, if you have to pick people up after the work day, so you have to get to the daycare, for example, or if you have to get to the hospital to take care of someone, that this will allow that flexibility. And also trying to reduce, this is a tricky one, especially during COVID, but trying not to send emails in the evenings or on the weekends. So I'm especially cognizant of that with my staff. I try not to bombard them with emails. I don't want them to feel pressure that they have to answer that. And this again is trying to offer flexibility and also trying to be mindful of career and family life balance. So trying to increase visibility, recognition, and representation. So thinking about leadership programs and formal leadership training and making sure that that's equitable across all genders, making sure we have role models. So it's so important to have different genders in these leadership roles because it gives everybody hope that, oh, I could see myself doing that one day, right? So having role models is actually quite important. And when we're thinking about doing social media or being involved with the media, trying to make sure that we're equitably increasing visibility of all genders. So there is some evidence to show that more men will be called on by the media or suggested to speak with the media than women, as an example. So when we're thinking about, we get the call from the media thinking, who could talk about this? Trying to make sure that we're being equitable with that as well, and just really trying to increase recognition and visibility. Also trying to create opportunities. So having things like peer mentoring programs. So that's a peer-to-peer thing, which is incredibly helpful, right? I don't know where I would be without my peers and without my colleagues, and we support each other and we help each other. And, we brainstorm and we think about different opportunities and we suggest each other for different opportunities. So having a really strong and making this actually official within your organization or institution. And then also having sponsorship. So sponsorship goes beyond mentorship. This is when you have such a vested interest in trying to promote this person, and you will do whatever it takes to make sure that they achieve their goals. So you are there as their sponsor. You will support them. You will ask them, what opportunities do you want in this next year? That's something that I do with my trainees, and then try to link them up with those opportunities. And I will do whatever I can to make sure that the people that I'm sponsoring will make it to the next level in their career and achieve their goals. Also providing financial support. Larissa will be talking about that with the budget announced yesterday for universal childcare as an example. So that would be an example of that. And then another interesting idea is actually a lottery for research grants. So this is when you just randomly select which I know this is a crazy idea, randomly select which grants are going to be successful. Okay, so this has been done in some countries, believe it or not, and it has been shown to reduce inequity. So I know I'm getting close to Larissa's time, and I don't want to infringe on her time, but just want to also point out some behavioral and systemic changes that is required. This is a systemic problem. It's a societal problem, so we need some very high level systemic and behavioral changes. These are very challenging to do. We need multi-pronged approaches. Just doing some awareness and doing a workshop on equity is not enough. We have to go above and beyond. So just to highlight some really high level ones here would be, communicating clear objectives for addressing inequities, having transparent policies for protecting whistleblowers, making sure that we highlight our champions of gender equity, and doing things like the proportional approach, which is what the Canadian Institutes of Health Research has done. So if 15% of women apply for a CIHR grant, 15% of grants that were funded or led by women, 15% of grants that were led by women will be funded. And then just quickly wanted to talk about the Athena Scientific Women's Academic Network Charter, or the Athena Swan Charter. So this has been a multi-pronged approach, and when they have examined it, it has led to a more satisfaction with the performance as well as processes for promotion and more optimism about career prospects. I do want to note that it has been shown that white middle-class women are the main beneficiaries of Athena Swan, so this is not enough on its own. And then also want to note that we have the Dimensions Charter here in Canada. So then just a quick plug for ongoing research. So we received funding from CIHR it's a living scoping review on the global evidence of gender inequity in academic health research. So we have like 40 collaborators, many of them are listed here as co-authors. So we're charting the evidence out there, and then the next phase of that is actually going to be looking at the interventions and looking at the evidence of those interventions, and that will be taking a multidisciplinary approach to that. And with that, I am now going to hand it over to Larissa. So Larissa, just bear with me for a moment. I am going to pull up your slides and get these ready for you. Close this one, otherwise I will get confused. Sorry, I'm just talking to myself. Here we go. And let me get to the right spot. Okay, just there we go. And okay, do you see that, everyone?
I can see it, I think.
Okay, I'll let you take over now then, and I will advance your slides for you, okay? Thank you.
Okay, cool. Yeah, I'll let you know when. Okay, so we have heard from Andrea about inequities facing women in medicine and some really great solutions for how to improve on this. And I wanted to speak about the disparate impact of COVID that women in academic science are experiencing. And I'll just note that this is actually as I started to prepare this material, it's really difficult because I feel like I'm now my own research subject, because I feel like as a woman in science, I've experienced some of these things, like some of you probably have. And so it's very challenging to think about this and to not get depressed about it. So anyways, we'll go from here. If you could advance to the next slide, please, Andrea. So the following slides are based on a commentary that we recently published in the Journal of Clinical Epidemiology. And to begin, so career progression for scientists in academia, as opposed to those in government or industry, it's largely dependent on their ability to publish as first or senior authors. And some institutions even have quotas or offer financial reward for publications meeting certain criteria. And so academic progression is also closely tied to grant funding, which is also partly dependent on publications as well. So for scientists who produce less publications than others, or who face systemic biases preventing them from publishing in top-tier journals, all of this can be a problem. And so I just wanted to stop and give an example here, because just last night I received an email from a young female researcher in Nepal who watched a talk that I gave last month on predatory publishing. And she wrote describing the challenges that her and her colleagues experienced when trying to publish in traditional index journals. So this researcher, in addition to having a lower baseline publication rate than her male colleagues, is also possibly faced with multiple systemic barriers or discrimination at journals related to her gender, her country's low income status, her language, and possibly other multiple factors. Yet she's required to accrue publications in order to advance her career. So I want to demonstrate through how throughout academic careers, and so this is a little different than for medicine, which I know Andrea focused on. I'm talking really about academic science careers. How typical measures, evaluative measures, do women a cumulative disservice while simultaneously favoring men. So I'm going to focus on this, and then I will move on to the impacts of COVID. So if you could advance to the next slide, please. So generally, academic career progression in science looks something like this. You start off doing graduate studies, and then some people do this alongside their medical training. After you graduate, you might take on a training position to help gain experience in publishing, acquire funding, teaching, while trying to build a network of collaborators. The goal of this journey, I don't think did we go to the next slide yet? Yeah, thanks. The goal of this journey, in addition to contributing to science, is to develop a CV that's competitive enough to obtain a faculty position or a scientist position. So next slide, please. So outside of one's career, some people get married, have a child or children, or are caregivers for elderly parents or family members with disabilities. And for many academics, a period in which some of these major life changes take place, marriage and childbirth, child rearing, they coincide with a really fragile transition period in early academia or early academic careers. So during graduate or postdoctoral training, or within the first few years of an academic career is when people are getting married, possibly having children. The problem with this, however, is that women's careers are more impacted by these circumstances than men's, since women carry the burden of carrying in domestic responsibilities in society, as Andrea mentioned, due to gender roles. And so in academia, the gender roles play out like this. Men in academic science are more likely to be in single career relationships. And as a result, they have less domestic and caring responsibilities than women in academia do. And this gives them more extracurricular time on average than women to devote to research activities. And at the same time that men are getting ahead, women have less time for research because they're more likely to be in dual career relationships, so where their partners also have a career. And so women assume domestic and caregiving roles more than men in academia do. And so you might notice here I've made the male scientists a bit bigger to reflect that more men start having bigger careers than women, and this also happens sooner for men than women. Next slide, please. Thank you. And there are also career-related factors that directly impact women's ability to progress while simultaneously boosting men's ability. An academic career often involves a geographic location, sometime between graduate training and early career. And throughout this trajectory, researchers are required to demonstrate their productivity through publications, build their network by attending conferences. They're expected to teach and mentor and also provide emotional support to trainees. And as sole income earners, men in academia are more likely to be able to relocate and travel out of town for these meetings. And so their network can grow and grow through these activities. And meanwhile, women who are in dual career relationships are less likely to be able to move around. And so as Andrea mentioned, women tend to be tasked with or take on more academic service work as well. So that means teaching, sitting on committees, and providing more of that emotional support. And so I just wanted to pause to say, well, these tangible inequities are, women are facing these tangible inequities. There's also the implicit biases and discrimination against women in academia that are taking place, and especially those who are racialized, have different sexual orientations or disabled, or have even other identities that place them at a societal disadvantage. So in addition to gender, intersecting identities further impact women's career trajectories. And thank you. So with childbearing and familial care and domestic responsibilities falling mainly to women, and with men more able to travel, network, and publish, it's not surprising that the academic pipeline is leaky for women starting in their early career and accumulating throughout the trajectory. And so a few years ago, I did a temporary research stint in Baltimore, and I was pregnant at the time and finishing my PhD. And the female professor who I lived with there handed me a book published in the 80s called Women in Academe. She said, I hate to tell you this, but having a baby in a postdoc is a real career killer. And she wasn't speaking from her own experience, but she wasn't wrong. A related book released in 2013 called Do Babies Matter, characterized based on multiple surveys of tens of thousands of researchers in the US, characterized the baby penalty for women. And it basically outlined how having a family and progressing in an academic career are profoundly incompatible for women, but not so for men. Next slide, thank you. And this February, research supporting this point was published, characterizing the specific motherhood penalties, demonstrating that women's publication track records fall behind, mothers' publications track records fall behind fathers and behind females who are not parents or males who are not parents. And you can see there's a significant gap there. So there's also an immediate drop-off following the birth of children. Next slide, please. And so what COVID has done is placed women at both the center and the margins of society. So women constitute the majority of frontline health responders, including early career physicians who have taken on significantly more duties than their older male counterparts. And this is largely due to early studies demonstrating that older males are at a higher risk of negative health outcomes from the virus. So their younger female colleagues stepped up. Around the world, the repeated closures of childcare centers and schools has placed greater responsibility on women as carers, forcing a lot of them to leave their jobs, take leaves from their jobs, or at least compromise their working hours. So women in academia are additionally providing more support, more emotional support to trainees who are being severely affected during this time as well. And so the situation has reduced the already lower time that women can spend on research activities. And so there's been a significant impact demonstrated in the number of research publications women are publishing compared to men. And I'll walk through some of those on the next slides. And early career women are also experiencing more mental health problems as a result of COVID than men or more senior researchers. And so a study last year demonstrated the profound impact COVID is having on early career women. In biomedicine, the first authorship position is typically occupied by early career researchers. And so this study looked at the first authorship position and showed a large drop off in women first authorship at the start of COVID compared to the average, which still hadn't recovered by December. And so I show you the average on the next slide. So you can see, in fact, that there was actually an increase in the submission rate with no drop off when you don't separate women. And there's, of course, other factors at play here impacting women's ability to progress. So when measured against men, women are cited less. They also self-cite, so they cite their own research less. They're selected less by peer review in journals. And when measured on their merit and performance, they're awarded less grants than men. And so research was done, next slide. Research was done examining CIHR's foundation scheme, which was introduced in 2014. And so in 2014, CIHR had the regular project grant scheme, which evaluated merits of projects. And then it also had the foundation program, which measured the merit of scientists. And so the gap between male and female researchers was significantly larger in the foundation scheme versus the project scheme, despite the research being evaluated at similar quality. And so the author suggested that these differences were likely due to implicit and systemic biases in the adjudication criteria, which favored men. So really focused on publication and collaboration. And the comment on this article predicted a significant increase in the gender gap if the competition were to be repeated over time. So while the gap wasn't massive, I think it was about a 3% difference. If it was repeated over time, men get farther and farther ahead. And so how can we address the additional inequities in academia that COVID has resulted in? So in the first instance, we need to collect more data on researchers' experiences and impacts due to COVID. We need to target solutions then that are focused on these at-risk populations, such as early career women and mothers. Women's achievements during this time ought to be highlighted, if not celebrated, in light of the significant barriers that women have to overcome in order to partake in scholarly activities. For example, so Andrea mentioned media interviews and putting women forward for media interviews. There's a ongoing initiative that I believe I've cited in the references that basically provides a list of women. I think it's 100 women who can give women experts who are giving interviews, available for interviews for COVID-related research. And so organizations could look to ensure more equitable balance in who are providing interviews, not just for COVID, but for all research. And again, that's something Andrea has mentioned already. Institutions could, in addition to setting hiring targets, look to diversify the information they use to evaluate researchers. So this is really looking at hiring and promotion. So a lot of the time we focused on publications. So I mentioned that earlier. We could look at other more qualitative measures, such as what colleagues have to say about the quality of research and even alternative research outputs, such as preprints, since they eliminate the implicit biases that may be present in journal peer review. And so some countries have started collecting data characterizing the impacts of COVID on researchers, and specifically on women in science. And in the US, the National Academies of Science, supported by the NIH, the NSF, the National Institute of Standards and Technology, and the Sloan and Duke Foundations, have supported this research. And what they're looking at are the specific impacts on women. And in Canada, we've not yet seen national investigation into the impacts of COVID on researchers. And this is something our group was exploring doing on a repeated and longitudinal basis. And so some funders, including CIHR, have announced early measures to try to address or reduce further inequities in the pandemic. So in this instance, this stop the clock measure introduced by CIHR for it was not limited to mothers or parents. And in fact, this could have a negative effect by enabling those without children to simultaneously be getting ahead while women and children are still operating at their normal pace, which is significantly behind the rest. So a targeted solution in this area, such as a dedicated funding stream for or reduced expectations for disadvantaged groups, which may never catch up, are probably needed. And so journals could introduce solutions to prioritize women-authored papers and women-led teams, and ensure women are represented among authors and editorial boards, peer reviewers, and journal staff. And so there's an example out of the Royal Society of Chemistry, which appears to have brought together the world's largest publishers to take collective action towards greater diversity and inclusion. So several publishers have in the last year started collecting data on authors, demographic data on author reviewers and editors. And this includes their gender, ethnicity, and country of origin. And then there are simple solutions for men in academic science who can insist on gender equity in their own research activities. And this is an example of male researchers who rejected invitations to speak on all male panels, which I've just learned are called manels. And Andrea mentioned the Athena Swan program and the Dimensions Charter, which is introduced in Canada in 2019. There's currently a pilot underway, and we're looking forward to seeing the results of the Dimensions program. And again, we wanted to acknowledge the $20 million in funding that was dedicated to CIHR to establish the National Research Institute for Women's Health Research in yesterday's budget. And so this should, over the next 4 years, help prioritize study of women's health, including the intersectional impacts. And so the conclusions here, I guess, between Andrea and my presentations are about, just to acknowledge there's widespread systemic gender inequity in academic medicine and science. And systems of academic rewards tend to benefit men's careers while simultaneously penalizing women. And this is being compounded in COVID. And early career women are at risk of falling too far behind and they may not be able to catch up. So solutions must be permanent and they must be a collective effort across stakeholders. And we just wanted to acknowledge here some folks who have contributed to the papers that we've discussed here today. So Andrea, I guess you can join me.
Thank you both for an excellent presentation. We're going to open things up for questions from the audience now. So please use your Q&A tab at the bottom of your Zoom control bar to ask your question. And if it is for one speaker or the other, please let me know that in your submission. And actually, we've got quite an engaged audience today because we already have several questions. So I'm going to quickly summarize for you. Andrea, you spoke about equity-based granting and grant lotteries. Are you aware of any approaches that actually fund more women-led projects?
So that's a great question. So thank you so much for asking that. So I think the objective with the lottery is not necessarily to fund more women's projects. I think it's just to kind of make sure that there's representation of the people who are submitting the grants and the people who are successful. In terms of more like funding agencies that are trying to fund more women, so hopefully with this announcement yesterday in the budget, that would be part of it. And I know, Larissa, you've spoken with the Michael Smith Foundation, and I know they've been trying to do a lot in this area. And I'm not sure, Larissa, if they mentioned that they're funding more, like a greater proportion of women, or if there's anything targeted towards that. She's shaking her head no. So yeah, did you want to add in, Larissa?
Oh, right. So I'm not sure that they've done some research in this area looking at the impacts of COVID specifically, and they're really interested in coming up with a new model of funding and a new project or granting scheme that can accommodate the disparate impacts that COVID is having. And so I don't know, I haven't seen from them whether or not they're doing something just yet, but I definitely know like we should stay tuned to what they're doing.
Yeah, absolutely. Thank you.
We've got a few questions that are asking about that intersectionality of different dimensions of identity with gender. And you both touched on that in the presentation. Some of the questions are asking about, is there any data on, for example, two-spirit, trans, non-binary, or femme folks? And one of the other questions is asking about the compounding effect of gender and race. So I guess what information is available in terms of demographics or research? And then in terms of some of the solutions, do those look different depending on who the individual is that it might be benefiting?
So Larissa, did you want me to go first, or did you, and then you'll add in, or?
Yeah.
Okay. Yeah, so I mean, I think like we had mentioned multiple times, when you look at the literature, the majority of it is on men versus women, unfortunately, and considering gender as a binary characteristic. So hopefully with time, there's going to be more statistics out there that would broaden our horizons and provide more data on this. So that's the first thing. And then the second thing is, you know, thinking about our multidimensional social identities. So there is evidence showing this double jeopardy. So if you have, you know, like how I had mentioned, the gender plus race or ethnicity, then it gets very, very troubling, and it's very concerning, and it's even much harder to get into those leadership positions, to, you know, move up the ranks. And it's definitely, the inequities are very much highlighted, and there is evidence on that. And I believe we cite some statistics in that CMAJ paper. I mean, I'm not sure, Larissa, in your paper, if we highlighted, I think we highlighted it a bit, but I'm not sure if there's any good examples.
Well, I think one thing that is obvious in literature is that this just hasn't really been looked at collectively. There's like a lot of information that could be pulled together, but our kind of studies are looking at one dimension at a time. So gender, looking at race, and rather than looking at this, you know, intersectionality of researchers or of people. And so I think that's one thing, like a suggestion for if we're collecting data in the future, for example, like the impacts of COVID on researchers, that we want to ask questions, maybe not in a binary way. So are you male or female? That is not adequate. We need to start asking maybe just an open-ended, how do you identify? And we can go from there. Ethnicity, it's similar problems. I mean, that's a very challenging one to collect. How do people self-identify ethnicity? I might give a different answer on a different day every time. So, right, we need to think about how do we collect that data and then actually start doing that, and how do we want to report that data. So you're correct that who's asking this question, that the data does look a certain way, and it's because we just haven't really asked the questions so far that are broader, and that we haven't collected data in the way that would maybe be most useful in looking at the big picture.
So in thinking about some of the systemic changes or programs that can be applied to address the inequities, whose responsibility is it to ensure equity in academic science and medicine?
I will go first, Larissa, and I would say it's all of our responsibility. We're all part of this society, so it's every single one of us. It's our organizations, it's our leadership, it's our being members of those organizations. So we all have to work together, because we've shown the value of having more equity. And you know, when they've done research into the best teams out there, the best teams are the diverse teams, okay? So it's actually in everyone's best interest that we go for diversity and inclusivity and equity. So it's everyone here, it's all of our responsibility to work together and make this happen.
Yeah, I don't know what I would add to that. I'd say it's everyone, and especially like the individual stakeholders. I wouldn't say like, I think you often hear like universities are doing something in isolation of funders and isolation of, you know, whoever else, but I think that needs to be probably a more collective strategy. And like what I presented on the study that's being done, or that was done in the US, which was by the National Academies of Science. So that was the National Academies of Science representing academies, institutions, researchers, and that was funded by their major funders in the US. So that's a nice collective effort, and the information and the data are now applicable to all across the spectrum. So I think something like that would be really important, that we engage everyone in finding the solution. And of course that takes funding. So probably maybe primarily initially funders. And, you know, we were really happy to see the budget announce $20 million towards this.
Absolutely.
I think it's really interesting that a lot of the solutions that you described for workplaces and for the education setting are actually people-friendly solutions that benefit a whole range of people. I have a question here of someone who's contemplating their own career trajectory, wondering if you've got any advice on how to find a sponsor. So Andrea, you talked about your own approach to working with your team members. Have you had a positive experience of having someone sponsor you? And do you have any advice about how do you seek those types of people out? Or how do you recognize them in your network?
That's such a great question. So I always say that I collect mentors. So I have a slew of mentors that I call upon at any time, and they've, you know, been monumentally supportive. And, you know, I wouldn't be where I am here today without the support of my mentorship and my mentors. In terms of sponsors, I'd have to say, you know, that my boss, Sharon Strauss, is very much a sponsor for me. How did I find her? It was by chance. We connected, and yeah, we've been working together for 11 years, and she's definitely been a champion for me. I guess it's trying to find people that it's like any relationship that you connect with. I guess hearing around, you know, that she was supportive, that helps as well. But I'm not sure, like, it's so relationship and so specific. I don't know if I have any, you know, tips on how to find that relationship other than, you know, meeting a lot of people and putting yourself out there and doing networking and finding people that you really click with and that you just like, you love talking. Like I could talk to Sharon, you know, for 5 hours. We don't have time because she's incredibly busy, especially with COVID, but like someone that you can sit down and talk with forever, someone that you know is supportive, someone that you hear is supportive, and also like something that I look for, and one thing that I really enjoy with Sharon is that she actually doesn't give me any answers. She just asks me questions. So, you know, I'll be like, oh, you know, what do you think about this? And she'll then like come back with all these like really insightful questions that I have to answer. So it's like finding people who really make you think. And Larissa, did you want to add to that?
That was going to be the point that I was going to add. So Sharon's also my mentor. And so we're both very fortunate. And I know Sharon can't be everyone's mentor, even though that would be amazing. But I think what you want to look for and seek out are people who are, as Andrea said, asking you questions about what you want, what opportunities you would like, and also helping you identify opportunities that can facilitate your career rather than someone who is perhaps saying, I think you should do this, this would be the right step for you. While that maybe is useful at different stages in the career, if you're really looking to, you know, be your own researcher and start thinking about like what you want to do, and of course have a successful research career, you probably want to start with someone who's helping you to learn how to think about that. So yeah, I don't think I have any great strategies other than that, sorry. But well, I mean, okay, well, we could just say that that's a great gap there. I mean, it'd be great to have more funding available for sponsorship within institutions so that researchers can actually mentor and sponsor properly with the proper resources.
Capacity is an important factor. Yeah, I think great advice about just trying people on. The more contacts you can make, the better. And also, you know, sometimes when you need help or you see an opportunity, you might have to ask. So that's something to keep in mind as well. Unfortunately, we're not able to get to everybody's question today, but thank you for everyone who did submit a question. We really appreciate hearing from you. Before we go, I would like to just give you a last opportunity, both of you, in maybe 30 seconds or less. What do you want our audience to take away from today's session? Just one point.
Yeah, thank you so much, Jocelyn. So I guess the one point would be a point of hope, and that, you know, hopefully we've provided some solutions that would be of interest, and that people are willing to take on and try, and hopefully, you know, we realize that this is something that's important, that we're all responsible for. Thank you so much.
And the one thing I think I'd want people to take away is something I actually read in the National Academy of Sciences survey, which was to get a posse. So if you're an early career person or someone who is in a position of disadvantage in academia, get a posse of people who are experiencing similar disparities, who you can talk to, start a conversation, feel supported. Like it's the only way, because there doesn't seem to be much else available right now. But I think, you know, to not be not to think that you're isolated in this situation. This is a really important point, that like we're all experiencing different disparities, I guess, right now and even before COVID. So I think it's important that we talk about it and support each other.
Thank you both very much for your presentations today, and thank you to our audience for spending an hour with us. As the Director of Governance here at CADIF, I'm going to use my prerogative to promote an opportunity. Speaking of opportunities, we're currently recruiting for 2 board member positions, including an academic member and a health system representative. So I encourage you to please visit our website, cadif.ca/nominations, to learn more about those opportunities. We're also recruiting for a number of opportunities on our expert committees. These are a great fit for clinicians. So please come visit, take a look. The call for nominations is open until Monday. And if you have any questions, I'll encourage you to reach out to me. Happy to have a quick chat with anyone who's interested about the opportunity. And I'll also quickly just plug a couple of events that are coming up. We've got a webinar on policy support and considerations for virtual care during and beyond the pandemic. That's on May 5th. And you'll also want to hear from Professor Gillian Lang, the Chief Executive of the National Institute for Healthcare and Excellence in the UK, on May 27th. So keep an eye on our website for these and upcoming events. And until next time, stay safe, everybody.